Congressman Chris Gibson, a Republican in New York, serves on the Armed Services Committee. Come back again.
Yeah, good to be with you, and God bless all the viewers out there.
So that does it for today's Washington Journal. As we said, the House is coming in early for its legislative session, and then it will be recessing for this week. We'll be back tomorrow morning, though, 7 a.m. Eastern Time. Enjoy the rest of your Thursday.
The House will be in order. The chair lays before the House a communication from the Speaker.
The Speaker's Rooms, Washington, D.C., September 12, 2013. I hereby appoint the Honorable Virginia Fox to act as Speaker pro tempore on this day. Signed, John A. Boehner, Speaker of the House of Representatives.
The prayer will be offered by our chaplain, Father Conroy.
Let us pray. We give you thanks, O God, for giving us another day. Though having returned so recently, the House prepares to leave for a long weekend. Many of its members prepare to observe Yom Kippur, the Day of Atonement. At a time of great international tensions, many others will take pause to acknowledge past failures and renew efforts at peaceful and productive resolutions to ongoing difficulties. On this day, give the members of this assembly listening hearts and a willingness to give each other time and attention. May they be ready to respond to your spirit, living in each of their colleagues. And may all that is done within the people's house this day be for your greater honor and glory. Amen.
The chair has examined the journal of the last day's proceeding and announces to the House her approval thereof. Pursuant to Clause 1 of Rule 1, the journal stands approved. For what purpose does the gentleman from Ohio seek recognition?
Madam Speaker, pursuant to Clause 1, Rule 1, I demand a vote on agreeing to the Speaker's approval of the journal.
Those in favor, please say aye. Those opposed, please say no. The ayes have it. The journal stands approved.
Mr. Speaker, I object to the vote on the grounds that a quorum is not present and make the point of order that a quorum is not present.
Pursuant to Clause 8 of Rule 20, further proceedings on this question are postponed. The Pledge of Allegiance will be led by the gentleman from New York, Mr. Tonko.
I ask that all visitors join us in pledging allegiance to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The chair will entertain up to 5 requests for 1-minute speeches on each side of the aisle. The gentleman from Ohio, for what purpose does the gentleman from Ohio seek recognition?
Madam Speaker, I ask unanimous consent to address the House for 1 minute and revise and extend my remarks.
Without objection, the gentleman from Ohio is recognized for 1 minute.
Madam Speaker, we're living in a dangerous world abroad with challenging economic times at home, but America has been here before. On Tuesday, Americans witnessed the embarrassing and dangerous results of this administration's lack of a coherent foreign policy. Vladimir Putin filled the global leadership void. What happens next with Syria and that region is anyone's guess, but it's clear that America is not in the driver's seat. The President failed to convince me and most of the American people that military action in Syria is in our best interest. This debate was not conducted from a position of foreign policy strength because Syria was allowed to fester. Flawed attempts at coalition building failed. Iran is ever closer to a nuclear bomb. Iran funds terrorist organizations. Iran's influence in the region is significant, and a Middle Eastern arms race would likely follow, the results of which could be catastrophic. The world is looking to America for leadership. The American people are looking to this President for leadership. Mr. President, it's time for you to step up to the plate. And with that, I yield back.
The gentleman's time has expired. For what purpose does the gentleman from New York seek recognition?
I ask unanimous consent to address the House for 1 minute and revise and extend.
Without objection, the gentleman is recognized for 1 minute.
Thank you, Madam Speaker. Recent superstorms like Hurricane Sandy, Hurricane Irene, and Tropical Storm Lee have tested the resiliency of our infrastructure. During these severe weather events, bridges failed, blackouts occurred, and communities were devastated by flooding at the same time that our water supply systems failed. It took weeks to restore these vital services. Our electricity, potable water, and transportation networks must be reliable even in the face of severe storms. The American people need and deserve a Congress that will work together to address the present and growing threat of climate change and do what is necessary to ensure the resiliency of our roads, bridges, electrical grid, dams, and water systems. Accomplishing this would create jobs and support our communities and our economy. This week, the National Oceanic and Atmospheric Administration reported that Sandy-like flooding is now twice as likely due to the sea level rise associated with climate change. One need look no further to understand that the time is now to act on climate. Thank you, Madam Speaker, and with that, I yield back the balance of my time.
The gentleman yields back. For what purpose does the gentleman from Tennessee seek recognition? Without objection, the gentleman is recognized for 1 minute.
Madam Speaker, all over this country, many thousands are not being hired because of the so-called Affordable Care Act, which is really unaffordable. Many thousands more are seeing their hours cut so they do not go over the 30-hour-per-week threshold. Someone said the new normal is now 2 20-hour-a-week jobs. Now the state of Tennessee has had to notify 16,000 Tennesseans they can no longer have coverage under Cover 10, a low-cost health care plan for small businesses and the self-employed. The plan is being abolished because it does not meet all the bureaucratic requirements of Obamacare. Senator Lamar Alexander said, quote, "The new health care law has destroyed an innovative state health insurance plan that is helping 16,000 Tennesseans afford health care coverage." When the President was selling Obamacare to Americans, he said again and again that people who had insurance they liked could keep it. Despite the President's promises, Tennesseans enrolled with Cover 10 are among the thousands of Americans who are being forced to buy new, more expensive plans with much higher premiums because of the Unaffordable Care Act. I yield back the balance of my time.
The gentleman's time has expired. For what purpose does the gentlewoman from Florida seek recognition? Without objection, the gentlewoman is recognized for 1 minute.
Madam Speaker, it's now been 2 years since President Obama stood before a joint session of Congress to present a comprehensive and cost-effective plan to address our national jobs crisis. With all eyes now on Syria, the CR, and the debt limit, we cannot forget that the emergency for tens of millions of Americans is still painful and pervasive joblessness. It's now been 2 years, and the President's bill, the Americans Job Act, has still not even received a vote in this House. Madam Speaker, it's time to commit to a serious jobs agenda that stops sequester layoffs and provides real options for long-term unemployed people in our nation. It's time to bring the Americans Jobs Act of 2013 to the floor. Madam Speaker, the mantra of this Congress should be jobs, jobs, jobs.
The gentlewoman's time has expired. For what purpose does the gentleman from Pennsylvania seek recognition?
Madam Speaker, I ask permission to address the House for 1 minute and to revise and extend my remarks.
Without objection, the gentleman is recognized for 1 minute.
Madam Speaker, my colleagues and I have returned to Washington after spending a week back in our districts with our constituents, and it's clear we've got our work cut out for us. Already, we've been hearing personal stories, and I know I did, of the folks in our districts who are having trouble making ends meet in the new normal under the Obama economy. And last week we found things were only getting worse with unemployment. This rate has been too high for too long. Millions of our fellow Americans are unemployed with an average of 8.5 months out of work. The simple truth is they deserve better. House Republicans have a solid plan to put Americans back to work and secure our future. And to do that, we believe the solution lies in expanding our freedom and opportunity, not restricting it. Madam Speaker, I yield back.
The gentleman yields back. For what purpose does the gentleman from California seek recognition? Without objection, the gentleman is recognized for 1 minute.
Thank you, Madam Speaker. I rise today in the United States Congress to celebrate and honor our local television station, started 60 years ago, KSBW, an NBC affiliate in the Central Coast of California. SBW stands for the Salad Bowl Capital of the World, which is what the Salinas area is known for. In September 1953, the station opened, and it proudly represented the whole feeling of the Central Coast to have a first television station. I was 12 years old, and I remember sitting there with my father as he was being interviewed on that television station. It went through decades of being the area's first station to provide local news. It was the first station to broadcast in color. It was the first to broadcast news reports from the field. It was the first to broadcast in high definition. For the past 15 years, the station has been owned by the 126-year-old Hearst Corporation and led locally through Joseph W. Heston as president and general manager. Hearst continues to operate the full-time Washington, D.C. News Bureau, making KSVW the only local station on the Central Coast to provide direct reports from Washington to local constituents. Congratulations, KSVW, for 60 years of firsts. I wish them another 60 years of great success on the Central Coast.
For what purpose does the gentleman from Pennsylvania seek recognition?
Madam Speaker, request unanimous consent to address the House for 1 minute and revise and extend.
Without objection, the gentleman from Pennsylvania is recognized for 1 minute.
Madam Speaker, I rise today to recognize National Suicide Prevention Week. Suicide is a serious public health problem that takes an alarming toll on so many individuals, including our military personnel and veterans. A growing number of returning service members and veterans suffer from post-traumatic stress, acute brain injuries, severe anxiety, depression, and a variety of other mental illnesses from battle. The U.S. Department of Veterans Affairs released a study in February of 2013 which estimates approximately 24 veterans commit suicide every day. Our highest priority must be the mental health and well-being of our friends, our colleagues, and loved ones, and also the brave men and women who serve our nation. Should one fear that someone they know is in crisis or depressed, giving that person an opportunity to open up and share their troubles with you can go a long ways. National Suicide Prevention Week is a time for all of us to learn more about suicide, its warning signs, and what can be done to help those in need. Thank you, Madam Speaker, and I yield back to balance my time.
The gentleman yields back. For what purpose does the gentleman from Florida seek recognition? Without objection, the gentleman is recognized for 1 minute.
Madam Speaker, I rise today to draw attention to a disease that plagues our nation and my home state of Florida. That is pancreatic cancer. Unfortunately, pancreatic cancer today remains the fourth leading cause of cancer death with a 5-year survival rate of just 6%. In 2013, pancreatic cancer is estimated to hit 3,380 new cases for that year. Last year, Congress passed the Recalcitrant Cancer Research Act, which calls on the National Cancer Institute to help develop a scientific framework for combating pancreatic cancer. This was an important step forward, but there is clearly more that we can do and should be done. We must continue to fund investments in the National Cancer Institute's research so that they can better understand how to prevent and treat this disease. Therefore, I urge my colleagues to support this critical funding and to renew and strengthen our commitment to combating pancreatic cancer. Thank you, and
the gentleman yields back. For what purpose does the gentleman from Oregon seek recognition? Without objection, the gentleman is recognized for 1 minute.
Thank you, Madam Speaker. In less than 3 weeks, the Special Immigrant Visa Program expires. This was something we created to help bring people who served Americans in Iraq and Afghanistan as interpreters, guides, drivers, people who helped our soldiers who put their lives at risk be able to escape to safety. There are people with long memories who are there seeking revenge. But sadly, this project has been hampered by what can only be charitably described as bureaucratic ineptitude. The State Department can't even tell us how many thousands of people are in the backlog. Chairman Rogers just this week told me that an interpreter for one of his heroes is trying to seek refuge in the United States. And the program will expire September 30th. If we can't help the State Department fix it, we can at least extend it in the continuing resolution so that we've got a chance for these people who gave so much for Americans to be able to get the refuge that they deserve.
The gentleman's time has expired. It's fine, it's Bill. It's for Bill. No, it's Diane's Bill, that's why she's here. Elmer's is on the committee. Diane's on the committee. How was your... Just sauntering in. For what purpose does the gentlewoman from North Carolina seek recognition?
Madam Speaker, I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks and to include extraneous materials on H.R. 2275.
Without objection.
Madam Chairman, I yield myself such time as I make...
Gentlewoman seek recognition to call up a bill.
Yes, ma'am.
Would the gentlewoman please state the bill that she wishes to call up?
H.R. 2775.
Clerk will report the title of the bill.
H.R. 2775, a bill to condition the provision of premium and cost-sharing subsidies under the Patient Protection and Affordable Care Act upon a certification that a program to verify household income and other qualifications for such subsidies is operational and for other purposes.
Pursuant to House Resolution 339, the amendment printed in House Report 113-206 is adopted and the bill as amended is considered read. The bill shall be debatable for 1 hour with 40 minutes, equally divided and controlled by the Chair and Ranking Minority Member of the Committee on Energy and Commerce, and 20 minutes equally divided and controlled by the Chair and Ranking Minority Member of the Committee on Ways and Means. The gentlewoman from North Carolina, Mrs. Elmers, and the gentleman from New Jersey, Mr. Pallone, each will control 20 minutes. The gentleman from Texas, Mr. Brady, and the gentleman from Michigan, Mr. Levin, each will control 10 minutes. The Chair now recognizes the gentlewoman from North Carolina, Mrs. Elmers.
Madam Speaker, I rise today to speak about the economic disaster facing all Americans on October 1st. Nearly 3 years ago, I decided to run for office for one primary reason: to defeat and repeal Obamacare. 3 years later, this terrible law is set to be implemented, and the dire warnings and predictions are already coming true. This past summer alone, we saw 3 major delays in the law's implementation, from the employee mandate to consumer price caps to the issue we are debating here today. Congresswoman Black's bill, H.R. 2775, the No Subsidies Without Verification Act, is a first step at attacking the latter. The premise of this bill is quite simple. Serving as the stewards of taxpayer dollars, it is one of our most important jobs as members of Congress. After all, dollars wasted by Congress or improperly spent by the executive branch has a direct impact on the budgets of families across this country who are struggling to pay their bills. This is why I was appalled by this summer's announcement from the Department of Health and Human Services. In the 600-page rule issued during the July 4th holiday, HHS stated that they would no longer verify income for Obamacare subsidies. Instead, the Obama administration would now rely on self-attestation and sample audits when launching Obamacare exchange subsidies, an initiative that is estimated to cost over $1 trillion over the next decade. After receiving criticism, HHS announced that they would reverse course and extend audits to all applicants. Yet, to this date, the administration has issued no formal change in the rule to codify this policy. In other words, they are saying one thing and doing another. As it stands today, the rule issued by HHS reads, "The exchange may accept the applicant's attestation without further verification." And yet, while verification has been removed, the fines remain in place. Any applicant who enters information improperly could possibly face a $25,000 fine. If the mistake is knowing and willful, the fine could grow as high as $250,000. As Ronald Reagan famously said, "Trust but verify." If history is any guide, these claims of accountability will be disregarded unless oversight is enforced. This only reinforces the need for the No Subsidies Without Verification Act. The bill would simply require certification systems to be in place so that the administrators can successfully and consistently verify eligibility before any premium and cost-sharing credit are paid out. Similar language is adopted by the Senate, but the bill before us would implement a bipartisan consensus and protect taxpayer dollars. It would do so by requiring the Inspector General of HHS to certify that income verification is in place before precious taxpayer dollars are wasted and abused. I urge my colleagues to vote in favor of H.R. 2775, and I yield back.
The gentlewoman reserves.
Yes, the gentlelady reserves.
The gentleman from New Jersey is recognized.
Thank you, Madam Speaker. I yield myself such time as I may consume.
The gentleman's recognized.
Thank you, Madam Speaker. The bill before us today is nothing more than another page out of the Republican playbook to delay, derail, and otherwise repeal the Affordable Care Act. Rather than a productive bipartisan effort to ensure successful implementation, Republicans will instead waste more precious floor time to take their 41st vote that undermines and repeals the Affordable Care Act. H.R. 2775 is based on a flawed premise that HHS does not have the verifications in place to ensure that families who are getting financial help are eligible for that help. But my Republican friends, that's simply not true, and your bill will do nothing but prevent millions of hard-working American families from gaining affordable health care coverage. First and foremost, this bill is totally unnecessary. HHS already has stated in regulations that they will check and verify income on 100% of the applications. And if someone receives payments that they determine aren't substantiated, those payments will have to be paid back. 100% verified and reconciled. And here's how it works. To get subsidies to make their health insurance affordable, hardworking Americans and families will submit their projected annual household income through the marketplaces. The data will then be checked against IRS data, Social Security data, and current wage information. If there is an inconsistency, the marketplaces will require additional documentation from applicants. In addition, marketplaces will check employer coverage information from the applicant and their employer against data from a number of employer data sources approved by HHS to verify eligibility for the subsidies. If applicant information and other data do not match, the marketplaces will ask for further supporting documentation. And lastly, all payments of premium tax credits are reconciled by IRS the following year. The income data submitted to the marketplaces are reconciled against the actual wages and health coverage information on the individual's income tax return. If there's an inconsistency, the applicant pays back the excess. So let me repeat that last part, Madam Speaker, because it's the most critical. Even after HHS has verified wage information on each individual situation that arises before tax credits are sent out, the income information will still be double-checked again against actual wages on the individual's income tax return the following year. So if there's an inconsistency, the applicant pays back the excess. There is, again, 100% income verification and reconciliation on the back end. Now, Madam Speaker, both CBO and JCT, the Joint Committee on Taxation, confirmed this, stating that the program HHS has in place satisfies the certification requirements under Section 1411 of the law, proving, again, that this bill is simply irrelevant. But of course, in light of this report, our Republicans at the 12th hour have hastily amended the bill. The new language will ask will basically ask to formally certify, or ask the IG of HHS to formally certify these verification systems, which does nothing but delay the start of the law and deny millions of hardworking Americans from getting the tax credits they're clearly eligible for. Now, I maintained in rules last night, and I'll maintain again, this is not the responsibility of the Inspector General. The Inspector General doesn't do this. They probably can't do this. The IG's office has confirmed these implications by stating that this new language places unworkable requirements on their office and that it has no resources to perform this and that it is outside of its traditional role. And so the Republicans know very well all of this, and that's the exact reason they made this change. It's simply a delay tactic. Again, the IG won't be able to do this. This is not their traditional role. So the only thing that happens here, Madam Speaker, is that this is a legislation which, of course, will never pass. But if it did pass and got signed by the President, which would never happen, it would simply delay implementation of the Affordable Care Act, and that's what the Republicans want. Repeal, delay, defund. This is what they're all about, the 41st vote again to repeal the Affordable Care Act. So, Madam Speaker, today we're 20 days away from October 1st when millions of uninsured Americans will finally get access to quality, affordable health care. No longer will hard-working families worry about getting sick or injured or losing coverage because of the loss of a job, because the Affordable Care Act gives health security and peace of mind. And for those hard-working families that need additional tools to help them afford their health coverage, the ACA will help make coverage a reality. So despite the delay tactics in this bill and millions of hours and dollars spent to derail the ACA, the law is moving forward. Organizations across this country, including labor, small businesses and employers, healthcare providers, advocates, religious leaders, and others, will continue to focus on helping uninsured Americans gain access to health care. I urge my colleagues to oppose this bill. It again is unnecessary delay, but I at least am optimistic knowing that the ACA will move forward and the Republicans will not have success. I reserve the balance of my time, Madam Speaker.
The gentleman from New Jersey reserves. The gentlewoman from North Carolina is recognized.
Madam Speaker, I recognize Chairman Pitts, the Chairman of the Energy and Commerce Health Subcommittee, for 2 minutes.
The gentleman from Pennsylvania is recognized for 2 minutes.
Thank you, Madam Speaker. I rise in support of H.R. 2775 and commend the lady, Congressman Black, and also Congressman Elmers for their leadership on this issue. Earlier this year, we found out that the IRS flagged for further review 90% of Americans who claim the adoption tax credit. 70% of the adoptive families faced at least a partial audit. Only a minuscule percentage of the tax credits given to these families were disallowed. Many needy families saw their returns delayed for months. We also found out this year that hundreds of conservative nonprofits had their applications for tax-exempt status delayed for months and years by IRS agents. Ask millions of small business owners who have spent hours laboring over tax returns. The government doesn't typically operate by the honor system. But when it comes to doling out billions of dollars in new Obamacare subsidies, the government is just going to accept applications without question on the honor system. This is all in the interest of getting Obamacare up and running as soon as possible without any regard to potential fraud. And it's after the old pay and chase model. We're entrusted with protecting taxpayer dollars, not watching them go out to people who don't need them. If the Treasury Department can't figure out how to prevent fraud, then subsidies shouldn't be going out the door. And if the tax subsidy is overpaid to the insurance companies for the tax credits for individuals, guess who pays back the overpayment? Not the insurance companies. It comes out of the individual's pocket. I'm sure I won't be the only person on the floor today to recall President Reagan's words, trust but verify. The byword for Obamacare is just simply trust. The Obama administration doesn't trust adoptive parents or conservative nonprofits or small businesses, but for the purpose of getting the President's signature legislation up and running, they're perfectly willing to see taxpayers get fleeced, and this is simply wrong. We need to demand the administration follow the law. Obamacare was such a landmark piece of legislation. Why does it have to be ignored at every turn?
Gentleman's time has expired. The gentleman from New Jersey is recognized.
Madam Speaker, I yield now 4 minutes to the gentleman from North Carolina, member of our committee.
The gentleman from North Carolina is recognized for 4 minutes.
Thank you very much, Mr. Pallone, for yielding time this morning, and thank you for your extraordinary leadership on our committee and in delivering affordable health care to every American. Madam Speaker, I rise this morning to oppose H.R. 2775. This bill, if passed by the House and passed by the Senate and signed by the President, which I would say is highly unlikely, would require the Secretary of Health and Human Services to certify to Congress that an income verification system is in place before any subsidies can be distributed for individuals to purchase health insurance through the marketplace. Here you go again. Repeal effort number 41. The Republican majority is obsessed with discrediting the President of the United States by using every procedural maneuver imaginable to weaken this law, which was passed by the Congress and upheld by the United States Supreme Court. I invite my Republican colleagues to read a report published by the Congressional Budget Office, which states that HHS already has in place sufficient safeguards for distributing subsidies to assist uninsured Americans with the purchase of insurance. This is not an honest system, Mr. Pitts. It is written into the law, and the Congressional Budget Office recognizes that we do have in place a system to verify the incomes. Mr. Speaker, I'm still fuming. Madam Speaker, I'm still fuming about the 15 Republicans on the Energy and Commerce Committee who on August the 29th sent a multi-page investigatory letter to 51 community nonprofits who have been approved to receive Navigator grants to assist the uninsured with the process. I simply do not understand how the chairman of a committee and a few like-minded committee members can simply author a letter to grant recipients demanding that they answer questions and produce documents. I suggest that this letter exceeds the authority of these individuals to harass and to intimidate grant recipients. I urge the Republican majority to stop trying to discredit President Obama. Stop trying to defund and repeal the Affordable Care Act. It is the law of the land. Millions of Americans are benefiting from it today and in the future. You should be using this creativity and this energy that you're using this morning to pass a budget and lift the sequester which is hurting families and communities all across America. My friends, get serious and let's stop playing games with the American people. Thank you, Mr. Pallone, for the time. I yield back.
The gentleman from North Carolina yields back. The gentleman from New Jersey reserves. The gentlewoman from North Carolina is recognized.
I now recognize Congresswoman Blackburn from Tennessee, Vice Chair of the Energy and Commerce Committee, for 2 minutes.
The gentlewoman from Tennessee is recognized for 2 minutes.
Thank you, Madam Chairman. And I want to commend Ms. Black from Tennessee, my colleague from Tennessee. She has done a tremendous job on bringing this legislation forward, and she brings it forward because of the experience we have had in Tennessee with a program that was called TennCare, which had no verification. It became just-in-time insurance, and guess what? It became too expensive to afford. When you do not exercise appropriate oversight and verification, that is what happens. You incentivize the use. Those that really do not qualify come onto the program. Indeed, we had a governor, a Democrat governor, by the way, that removed about 300,000 individuals off this program. I am pleased that as we discuss and stand in support of H.R. 2775, that my colleagues across the aisle are getting our message. When it comes to Obamacare, yes, delay, defund, repeal, replace. That is exactly what we want to do, because this law has become so amazingly unpopular with the American people. Indeed, with women, over 65% of all American women oppose this law and the implementation of this law. The reason we are bringing this legislation forward is because there is a gaping hole. We know that having self-attestation for getting these taxpayer subsidies in these exchanges is going to lead to an incredible amount of fraud. We're even having estimates of as much as $250 billion worth of fraud that could be going into this program. We're not acting on theory. We're looking at what has previously happened with programs such as TennCare, and indeed my colleague from New Jersey has heard me talk about this for years and knows that when we look at something that is public option health care, that is the public option from which we draw our experience. I yield back.
Gentlewoman's time has expired. The gentlewoman from North Carolina reserves. The gentleman from New Jersey is recognized.
Madam Speaker, I yield 3 minutes to the gentlewoman from California, Ms. Capps, who's a longtime supporter and person in the mix on health care, certainly as a nurse and health care professional.
Thank you.
The gentlewoman from California is recognized for 3 minutes.
Thank you, Mr. Chairman. My friend from New Jersey, and Madam Speaker, I rise in strong opposition to this bill. Our nation is facing a host of challenges. We need to end the sequester. We need to fund our government properly to avoid a shutdown. We need to increase the debt limit so that we can pay our bills and maintain a strong credit rating. And we must have a full and open debate about what to do in response to chemical weapons used in Syria. But instead of any of these pressing issues, here we are again, at the insistence of the House majority, voting for the 41st time to repeal, defund, obstruct, or derail the Affordable Care Act. And they want to do so as more and more Americans, including my constituents on the Central Coast of California, are now beginning to benefit from the law. Already, 11,000 young adults in my district have gained health care insurance coverage under their parents' plans, allowing them to pursue their education or start new ventures without the fear of going bankrupt if they should get sick. Almost 300,000 of my constituents are now able to get the preventive health services they need without worrying about the cost. And 10,000 seniors have already found relief when falling into the dreaded prescription drug donut hole in Medicare. And in less than 1 month, California families who for so long have been priced out or denied coverage in the private health insurance market will finally get the coverage they want and deserve. Throughout the program, we call it Covered California Exchange. Along with health care marketplaces all across this country, individuals, families, and small businesses will gain a transparent one-stop shop to compare health insurance policies. They'll also be able to receive financial assistance to sign up for high-quality, affordable, and insecure insurance coverage. And they won't have to worry about being denied coverage for their pre-existing conditions. But this bill before us would erode all of these benefits, essentially blocking hardworking families from getting the affordable health insurance coverage they need. American people have moved on. They want us to come together to improve our nation, not to divide it. So I urge my colleagues to vote no on this bill. Let's get to work on the many critical issues facing our nation. I yield back the balance of my time.
The gentlewoman yields back. The gentleman from New Jersey reserves. The gentlewoman from North Carolina is recognized.
Madam Chair, I recognize Congresswoman McMorris Rogers from Washington for 2 minutes. She is the chair of our Republican conference.
The gentlewoman from Washington is recognized for 2 minutes.
Thank you, Madam Chairman. In less than a month, enrollment for Obamacare's largest entitlement program will begin. Subsidies will go out the door on January 1st, and they will go to anyone who claims they are eligible. No verification, no accountability. GAO has told us, and the Inspector Generals for both Health and Human Services and the IRS have told us, that the administration's verification system is extremely vulnerable to fraud. But the picture gets worse. In 2012 alone, Health and Human Services gave out more than $64 billion in improper payments. In fact, the Department of Health and Human Services, the agency charged with implementing these exchanges, has the highest annual improper payment rate among federal agencies. The Department of Treasury, which is responsible for enforcing 47 different tax provisions, is second only to Health and Human Services. The Wall Street Journal recently reported that not verifying eligibility could cost taxpayers more than $250 billion in improper payments. Yet the administration doesn't seem to care. Over the last several months, we've seen the wheels falling off. The delay in the employer mandate, the delay in the consumer cost containment rule, the delay in the finalizing agreements with insurance plans, and now this delay in ensuring that the verification mechanisms are in place to protect taxpayers. This administration has made one thing clear. It will stop at nothing to ensure that 7 million people are enrolled in exchanges in 2014, 2.4 or 7 that must be young in order to make it work, and that subsidies are handed out to as many Americans as possible. The administration's decision to allow enrollees to self-attest to the information provided to the exchanges is not only irresponsible, but ripe for fraud. The only real solution is the passage of H.R. 2775, and I urge our colleagues to support this bill.
The gentlewoman's time has expired. The gentleman from New Jersey is recognized.
Madam Speaker, I yield 2 minutes to the gentleman from Oregon.
The gentleman from Oregon is recognized for 2 minutes.
Thank you very much. Madam Speaker, this is sort of a charade that's going on today. Our Republican friends in many other areas allow, for example, businesses to self-certify in a whole range of areas. And this is not about that. What this is another attempt to sabotage health care reform. America's involved with a grand reform. Some of us are in states like Oregon, California, Washington, New York, Maryland, where we're actually working to implement the reform. And our citizens are going to have lower rates, more choices, and subsidies for individuals and small businesses for better coverage. In a lot of America right now, some of our Republican friends have decided to sabotage it. Customers won't get extra help in Alabama, Oklahoma, Texas, or Wyoming, where insurance commissioners won't even review health plans to make sure that they're offered in the new marketplaces to provide consumers with required benefits and protections. In Missouri, believe it or not, the Republican legislature has made it illegal for new health insurance marketplace for state employees to tell people what they're eligible for. And today, this is one more effort to throw sand in the gears. Now, the Republican response, who have no vision for health care, who refuse to acknowledge that what we are working on now, and they derisively call Obamacare, actually had its roots in a bipartisan consensus of what's necessary to get more value out of American health care. The health care reform train has left the station. We simply reject today this misguided attempt to sabotage it, and we'll be able for Americans from coast to coast to see the difference from communities that are embracing it and implementing it versus those that are trying to sabotage it. And in the course of the next 2 years, the facts will be clear. Mercifully, what they're going to pass today is not going to be enacted into law, and the rest of us can get to work implementing reform. Thank you.
The gentleman's time has expired. The gentleman from New Jersey reserves. The gentlewoman from North Carolina is recognized.
Madam Chair, I'd like to yield to myself 45 seconds just to outline some of the things that have already been repealed in Obamacare. As a consequence of Congress passing Obamacare, to find out what is in it, we have found some terrible ideas in the law. To date, the President has actually signed into law 7 bipartisan bills repealing or defunding parts of the health care law. H.R. 4 repealed the small business paperwork mandate, or the 1099. H.R. 1473 cut $2.2 billion from a stealth public plan and froze the IRS budget. H.R. 674 saved taxpayers $13 billion by adjusting eligibility for Obamacare programs. H.R. 2055 made more cuts to co-ops, IPAB, and the IRS. H.R. 3630 slashed billions from Obamacare slush funds. And I can go on, Madam Chairwoman. And I would like to now introduce my colleague from Pennsylvania, Congressman Pat Meehan, for 2 minutes.
The gentleman from Pennsylvania is recognized for 2 minutes.
Thank you, Madam Chair. I rise today in support of the No Subsidies Without Verification Act, legislation of which I'm a proud co-sponsor. And October 1st is only days away, and almost every day we see a brand new headline about Obamacare demonstrating the train wreck. As one senator put it, that is their words, not mine. The thousands of rules and regulations and mandates are only increasing the cost of health insurance and dramatically expanding the bureaucracy in our health care. and the implementation of Obamacare has been one disaster after another. Buried in the hundreds of pages of regulations that have been released this summer, including a rule change announcing that the government will no longer verify whether applicants for Obamacare's insurance exchange are actually qualified for the aid. Instead, they will simply rely on the honor system. Madam Speaker, we're talking about billions of dollars here. How can we possibly be relying on an honor system? According to the Wall Street Journal, it's estimated that not verifying the eligibility could result in approximately $250 billion in fraudulent payments. The No Subsidies Without Verification Act will stop any taxpayer funding subsidies until an accurate, real-time verification system is in place to ensure the applicants are indeed eligible. It seems like common sense to me. We need a trusted system in place to stop any waste, fraud, and abuse resulting from not verifying eligibility for Obamacare insurance subsidies. This is being operated through a data hub, which will have millions of persons personally identifying information. Most concerned, this is going to be a honeypot for identity theft and the very purpose for which it was put in place in the first place. This income verification is not capable of being accurately done because this administration has refused to allow the businesses who will give the information to apply. So I am a proud co-sponsor, and I urge passage of this bill. Thank you. I yield back.
The gentleman's time has expired. The gentlewoman from North Carolina reserves. The gentleman from New Jersey is recognized.
Madam Speaker, I yield 2 minutes to the gentlewoman from Texas.
I thank the gentleman from New Jersey, and I rise today to ask the incredulous question of how many times do we have to say no, and how many times does the American people have to say, take your hands off my good Affordable Care Act that has allowed millions of Americans to have preventable care, that is being poised to attack the scandalous high percentage of uninsured in the state of Texas, being the #1 state with uninsured persons. How many times? First of all, this bill is frivolous. And the reason is because there is a construct in this bill, the Affordable Care Act, to deal with all of the questions that they've asked. First of all, it will require that individuals will have to submit their projected annual household income. All income data submitted through the marketplace will then be checked against IRS data, Social Security data, current wage information. If there is inconsistency, the marketplace will require additional documentation. In addition, marketplaces will check employer coverage information from the applicant and their employer against data, OPM, and the shop marketplace, as well as other data sources. It is absolutely absurd for this bill to place more responsibilities on an already sequestered government. If my colleagues want to do anything to provide any substance to what they're talking about, let's put a bill on the floor to end sequestration. There's no resources that would add to the Inspector General's ability to do all that they're said. Let me add further insult to injury, and I want my constituents to listen closely. $67 million was given to navigators to provide the kind of oversight and instruction that these individuals on this bill have suggested they need. But what I find appalling, and what I've not seen in my tenure in Congress, is the numbers of members of the Energy and Commerce Committee that have sent a letter to the 51 navigators governed by the Health and Human Services to require them to send information. I want my navigator that received a grant from HHS to refuse to do anything with that letter. And I'm going to ask the Secretary of HHS to reject this letter that has no authority in law, again, trying to abuse and reject the idea of Affordable Care Act. This bill should go down, and don't answer the letter. This is a bad way to deal with health care in America. I yield back.
The gentlewoman's time has expired. The gentleman from New Jersey reserves. The gentlewoman from North Carolina is recognized.
Thank you, Madam Chairman. And I would just like to point out to my colleagues across the aisle, in the latest Wall Street Journal article of September 10th, one of the things that they point out again is that in the Senate, which is the Democrat majority, they put in an HHS spending bill a sense of the Senate that the provision for income verification be in place. This is something that is very important. It is common sense. And Madam Speaker, wouldn't it be just a major common sense issue to just simply put in place a proactive prevention of fraud, waste, and abuse? I would also like to point out to my colleagues that have discussed the issue of whether or not the Inspector General has the ability to do so. First and foremost, we wouldn't be approaching this in this manner if the rule had not been removed. And yet, we have to have a system in place that will address these issues. There is no reason that we can't approach it from this, again, very common sense approach where we ask that we actually have a rule put in place. We can't simply move forward on this incredible disaster of a law when we are not asking for some verification. I think it's a very simple move. I think it's a very common sense move. I yield back the remainder of my time for now and reserve.
The gentlewoman from North Carolina reserves. The gentleman from New Jersey is recognized.
Madam Speaker, can I ask how much time remains on both sides?
The gentleman from New Jersey has 5 minutes remaining, and the gentlewoman from North Carolina has 6 minutes remaining.
I would yield 3 minutes now to the Chairman Emeritus of the Energy and Commerce Committee, Mr. Dingell.
The gentleman from Michigan is recognized. The gentleman from Michigan is recognized for 3 minutes.
Well, here we go again. Time of the House is being wasted. The business of the nation is being obfuscated. The Republicans have got more nonsense to put on the floor. We're told that this is important. That's baloney. This is the 41st time that the Republicans have tried to gut the Affordable Care Act. They don't understand that you are supposed to respect the will of the people and to carry forward the business of the nation. What a shame that we have such kind of behavior on that side of the aisle. Now, all members agree that we have to verify the incomes of those getting subsidies through the marketplaces. And that is exactly what is going to take place starting October 1. This is obfuscation and deceit. All income data will be submitted through the marketplaces and will be checked against data from both the IRS and the Social Security Administration under existing practices. This is a lot of witchcraft and baloney. If there is an inconsistency, then additional documentation is going to be required. Furthermore, all the subsidies are reconciled by the IRS when an individual files their tax returns. This is just spinning of people who don't want the legislation to come to be. And again, this is the 41st time we've engaged in this silly exercise. The practical effect of this bill will be denying millions of Americans from getting subsidies for purchasing health insurance. Its purpose is to delay and obfuscate the implementation of the legislation that it is supposed to be helping. To pass this bill is simply going to prove to be a malicious assault on the most vulnerable people in our country and those most in need of the Affordable Care Act. We've seen this song and dance before. As I mentioned, this is the 41st time we've engaged in this nonsense, wasting about $1.5 million each hour we're doing this. I urge all of my colleagues to join me in opposing H.R. 2775. This is political gimmickry. It is going to have harmful effects, and it is intended to do so. I urge that the legislation be rejected and that we stop this nonsense and we get going forward to trying to see to it that we do implement in a proper way the Affordable Care Act. I thank my good friend from New Jersey for yielding this time to me. I urge my colleagues to reject this nonsense. I yield back the balance of my time.
The gentleman yields back. The gentleman from New Jersey reserves. The gentlelady from North Carolina.
I'd like to have 2 minutes to respond to some of the comments from my esteemed colleague.
Gentlelady is recognized.
Yes, this is theory. That's basically what we have now, because as the rule was removed the week of the 4th of July, there has been no rule put in place to replace it. So basically what we're hearing is the description of how it would be run if the rule was in place. Mr. Speaker, August 5th, frequently asked question document was given out by HHS and the administration, which basically explains the verify process. The Federal Exchange, but outlines no details on how it will occur. Additionally, this fact sheet has no force of law. Even worse, the fact doesn't even pretend to address the verification applications submitted to Obamacare exchanges administered by the states. It simply says that the state can choose whatever sample size it wants to audit, meaning no actual verification may occur before millions of dollars of taxpayer-financed benefits are paid out. While I believe America is a nation of honorable people, we have to remember there are always those who will abuse the system. The fact sheet from CMS doesn't change the status of the rule. States can continue to audit whatever sample size they see fit or simply not audit at all. Mr. Speaker, I reserve the balance of my time.
Gentlelady from North Carolina reserves.